I amputated her leg yesterday. She unfortunately had a bad injury in the snow and actually had a tarsal fracture or complete luxation, and the bones were actually sticking through the skin. And so we talked about the two options, which would either be surgical repair of that, something called a tarsal arthrodesis with plating and things, versus removal of the leg. Certainly due to cost concerns, her owners elected to have the leg amputated. And we always say that dogs have 3 legs and a spare, which they do, and they tend to do really well, especially with rear leg amputations. The nice thing here is Echo is really nice and fit. She's not horribly overweight. She's a young dog, and you can see, when I amputate rear legs, she wants to give smooches, we amputate right at the coxofemoral joint, so right at the ball and head there, and then remove and ligate the muscles, the important vessels, and then close this. So this is literally 12 hours, about 24 hours post-surgery. You can see she's comfortable with it. Now we certainly have her on some good pain medications and things, but she's already walking around, doing great, so she won't look back at all. So she's gonna have really a 2-week recovery where we want this incision to heal nicely. She'll be on leash walks and things like that, but you can see she's moving around great, and she will live a long, happy life without her spare leg now. Okay, so this is the leg that I removed from our amputation girl, and the reason it was removed is because of this fracture here. So unfortunately she was playing in the snow and jumped on her dad, her and her housemate, and he accidentally fell on the snow and ice, and so this was a complete tarsal fracture. And you can see here, if you get a little bit closer, that this bone is completely disarticulated and was sticking through the skin. And so this was going to require surgical fixation with plates and screws to be able to stabilize this, to give this dog a working limb again. Certainly that is not an inexpensive procedure, and we discussed it with the owners, and they elected to amputate the leg for her comfort. We always say, again, dogs have 3 legs and a spare, and this is a pretty significant injury. If she had fractured it here or something, we would have been able to put a cast on it, been able to get this to heal. So we disarticulate, and you can see right at the head of the femur here, so I disarticulate and take the whole leg. To me, I think that's the most cosmetic way to do this type of procedure. And then all of these muscles that are transected are closed down so that it gives her a nice little stump that you could see, and it's comfortable. So this is the leg that we removed entirely, and so she is doing very well. But again, this was unfortunately a pretty catastrophic injury to this tarsus here and these metatarsal bones, and so there was just no other option besides either repairing it with plate and screws versus amputation leg. So she'll do very, very well, and here's our leg.